Welcome to section 4 of neurology. In this section, I will be discussing the hypothalamus, thalamus, and the limbic system. Let's get started. This is figure 8.3 from your text, which is a mid-sagittal view of the brain. Again, this is anterior, and this is posterior. In this image, we can clearly see the thalamus right here, and we can also see the hypothalamus. Let's talk about the thalamus first. This is table 8.2 from your text, which shows the highest yield information relevant to the thalamus. We've covered or will cover all of these pathways throughout the various sections in this chapter, so I'm not going to spend time mapping out each of these pathways right now. However, this table is a good summary of the pathways that interact with the thalamus, and you will need to know all of this information for step 1. This is table 8.3, which shows the hypothalamic nuclei and their corresponding functions. For step 1, you need to know the names of each hypothalamic nucleus and its associated function. Again, I'm not going to read this table to you, but you do need to memorize this information for step 1. I recommend that you pause the video and take some time to memorize both of these tables if you're unfamiliar with this information. Okay, before we jump into some of the questions, let's briefly discuss the limbic system. This is figure 8.4 from your text, which is a lateral view of the limbic system and the basal ganglia. This figure is especially helpful in viewing some of the structures of the limbic system. The limbic system includes many structures, including the hippocampus, the amygdala, the mammillary bodies, the fornix, the cingulate gyrus, and others. However, for step 1, it's most important to be familiar with the hippocampus, the amygdala, and the mammillary bodies. For step 1, you need to know that both the mammillary bodies and the hippocampus are associated with memory. However, the main cause of damage to the mammillary bodies is thiamine deficiency. On the other hand, if the question stem doesn't mention thiamine deficiency, then the hippocampus was most likely damaged. It's also important to know that the hippocampus is highly susceptible to damage under hypoxic conditions. So again, if you get a question about issues with memory, it should make you think of problems with the mammillary bodies or the hippocampus. If the question stem refers to thiamine deficiency, then you should think of damage to the mammillary bodies. However, if the question stem doesn't mention this, or it also mentions some hypoxic incident, then you should think of damage to the hippocampus. Okay, moving on to the amygdala. The amygdala is associated with emotions and decision-making. For step 1, you need to know that bilateral damage to the amygdalas results in hyperorality, hyperphagia, and hypersexuality. And this is a syndrome called Kluver-Bucy syndrome. Okay, let's see what your text says. So again, the mammillary bodies and the hippocampus are associated with memory. And if you get a question about thiamine deficiency, you should think of damage to the mammillary bodies. And if you get a question about hypoxia and memory loss, you should think about damage to the hippocampus. The amygdala is associated with emotions and decision-making, and bilateral damage to the amygdalas results in hyperorality, hyperphagia, and hypersexuality, which is a syndrome called Kluver-Bucy syndrome. Okay, let's wrap up this section with a few questions. Researchers are studying a hypothalamic nucleus that may be damaged in patients with Prader-Willi syndrome. What nucleus are the researchers most likely studying? So the question stem mentions Prader-Willi syndrome. Recall that Prader-Willi syndrome is caused by a deleted or mutated portion of chromosome 15 that should normally be passed on by the father. Let's draw this out. The maternal region of chromosome 15 is normally silenced. So 15 is silenced. And the paternal region of chromosome 15 is normally passed on to the child. So this is normal. As you can see, the maternal portion of this chromosome is normally silenced, so the baby must get this region of chromosome 15 from dad, or the baby will develop Prader-Willi syndrome. In this example, our patient has Prader-Willi syndrome, so we can assume that he has a silenced 15 from mom, and then a defective 15 from dad. So again, dad's chromosome is defective. In order to get this question right, you need to recall that symptoms associated with Prader-Willi syndrome include hyperphagia and obesity. This question is asking about what hypothalamic nucleus may be involved in this disorder. Recall that the ventromedial nucleus of the hypothalamus normally mediates satiety, or a sense of fullness. So if this nucleus is damaged, then patients will constantly feel hungry and overeat. So again, the ventromedial nucleus of the hypothalamus normally causes satiety. So you can imagine if this is damaged, then patients will constantly feel hungry. And because our patient is overeating, we can assume that the researchers are most likely studying the ventromedial nucleus of the hypothalamus. So the ventromedial nucleus. From table 8.3, we can see that the ventromedial nucleus normally mediates satiety. So damage to this region of the brain would result in hyperphagia, as I just showed. Okay, let's do another question. A 72-year-old female presents with loss of proprioception, vibration, temperature, and pain on the left side of her body. What thalamic nucleus is likely damaged? Okay, so in order to get this question right, you need to be familiar with the tracts that convey proprioception, vibration, temperature, and pain. Recall from section 2 that the spinothalamic tract, ST for short, conveys information about pain and temperature, and that the dorsal column, so DC for short, conveys information about proprioception and vibration. Both of these pathways synapse on the ventral posterolateral nucleus, or the VPL. In this case, we can assume that the VPL must be damaged because information from both tracts are affected. Because both of these pathways decussate or cross over to the opposite side of the body, we can assume that the right VPL must have been damaged. So again, the right VPL was likely damaged. From table 8.2, we can see that both the spinothalamic and dorsal column tracts convey their information to the ventral posterolateral nucleus of the thalamus. If this example was confusing, I encourage you to go back to section 2 and watch the videos about the spinal tracts. The goal here is not to focus on the spinal tracts, but the nuclei of the thalamus. Okay, let's do another question. A 28-year-old homeless man presents to the emergency department after being mugged. He repeatedly asks where he is and seems confused. Upon exam, you notice complete paralysis of the eyes. What region of the brain is likely damaged? Hopefully you notice several key components from the question stem. Our patient is homeless. He has memory problems, as we can see, because he repeatedly asks questions, and he has ophthalmoplegia, or paralysis of the eyes. This description should make you think of alcohol abuse resulting in vitamin B1 or thiamine deficiency. Recall that thiamine deficiency can result in a syndrome called Wernicke-Korsakoff syndrome. This syndrome results in several symptoms including memory loss, ophthalmoplegia, personality changes, and others. It's high yield to remember that in this syndrome, the mammillary bodies are damaged. And this explains the memory loss and the confusion. So again, the mammillary bodies are most likely damaged because this patient has thiamine deficiency. From figure 8.4, we can see the mammillary bodies right here. Okay, let's do one more question. A 24-year-old man recently returned from his first trip to Mount Everest. During his ascent, he became injured and lost several liters of blood. Since returning, he has had difficulty forming new memories. What region of the brain was likely damaged? So unless the question stem alludes to damage to the mammillary bodies, as we saw with the last example, memory loss should make you think of damage to the hippocampus. So we know that this patient has had difficulty forming new memories, and there's no sign of thiamine deficiency, so we should immediately think of damage to the hippocampus. Also recall that the hippocampus is highly susceptible to damage under hypoxic conditions. Because this patient was at high altitude, which we know because he was climbing Mount Everest, and we know that he lost several liters of blood, we can assume that he experienced severe hypoxia. So again, hypoxia results in damage to the hippocampus, which results in an inability to form new memories. Again, from figure 8.4, we can see the hippocampus right here. And that concludes this section.